Hi, my name is Marley Elconin. I'm presenting today on our survey, Relationship and Sexual Health Education for Autistic Adults. And I'm part of the ARP team at the University of Alaska Anchorage Center for Human Development. A bit about our background, our survey background. Our Center for Human Development, ARP research team, developed a survey on relationships and sexual health for autistic adults all the way back in spring of 2022. Our team conducted a literature review to determine the survey questions. And while we were in that process of testing our questions, we received feedback from an autism self-advocate and LEND fellow. When it came to distributing our survey, we made a list of agencies and organizations across the US that connect with autistic adults. This list included developmental disability councils, statewide independent living centers, and the bulk of this list was local and regional autism advocacy groups. The team emailed the survey to this list of contacts. And in the email, we asked that they forward the survey link to other individuals, agencies, or organizations that they thought might also be interested in taking the survey. And we referred to this research method as snowball sampling. Before I dive into the survey results, why did we decide to do relationships and sexual health? In our literature review, we found that autistic adults' intimate relationship development is an often ignored research topic. And so we found that research was needed to address the common misperception that autistic adults lack interest in personal relationships. So our research question became, what education and support do autistic adults identify as the most effective and important to them in building their confidence to pursue interpersonal and/or sexual relationships and sexual health? So diving into our survey results, we've received 145 usable responses in the 2 years since the survey has been open. Our first takeaway from our responses is that any kind of education and support for autistic adults on sexual health and dating must emphasize digital literacy. We found that particularly respondents ages 18 to 24 significantly use digital sources like social media, texting, and dating apps to date and make connections. We also found that respondents across the age spectrum receive dating and sexual health information mostly from informal sources like friends and family, internet, and other media sources. Our second takeaway is that to recognize the support and educational needs of particularly transition age youth with autism in the areas of sexual health and dating, our respondents ages 18 to 24 were most likely to be interested in having a romantic relationship. They were also most likely to turn to an informal source for information about dating and sexual health. And I think particularly they were least likely to have spoken to a healthcare provider about sexual health topics. And then our final takeaway is that autistic adults of all ages on this survey reported interest in learning more about different types of relationships. So they reported that they wanted to learn more about building friendships, maintaining all types of relationships, and particularly setting boundaries in all types of relationships. Lastly, talking about our community impact of this survey, UAA, or University of Alaska Anchorage, Center for Human Development, houses the Friendships and Dating Program, which is an almost internationally recognized train the trainer program for teens and adults with intellectual and developmental disabilities to develop and maintain healthy relationships and prevent interpersonal violence. And so we intend for these survey results to update friendships and dating materials to include perspectives from autistic adults. We experienced kind of a significant challenge with this survey in the development of our survey questions. We did not experience engagement from our disability advocates like we usually do. And also in our survey responses, we did not experience the level of response that we thought we might, due to the survey topics of sexual health and relationship education. So thank you. Again, my name is Marley Elconin. I'm a research professional too at the UAA Center for Human Development. Here's our QR code on the screen. This is a link to the survey, which is still open, and we'd love to hear from you. If you'd like to reach out to me, my email is listed here, and you can also call me at 907-264-6238. Thank you.